Welcome to Carter at Ob-Gyn, and congratulations on your pregnancy. I'm Dr. DeAndrea, one of 6 obstetricians at Carter at Ob-Gyn. At the end of your visit today, you'll get an OB packet with information. Be sure to go through it. Many of the things that I'll review here will also be covered on paper. In addition, links to other resources are available on our website. You'll have an OB physical sometime within the next week or so. We will likely determine your due date at that visit. At that visit, we'll determine exactly how far along you are in your pregnancy. As you travel through your pregnancy, you'll see a provider at regular intervals. The visits will become more frequent as you near the end of your pregnancy. Usually, the frequency of visits is as follows. Every 4 weeks until you reach 30 weeks along, every 2 weeks from 30 weeks until 36 weeks along, then every week after that until you reach 41 weeks. Sometimes we'll need to see some patients more often if they develop a medical issue during pregnancy. We'll let you know if that happens to you. There are 6 obstetricians at Carter at Ob-Gyn. You'll rotate among all 6 of our providers who deliver babies. We'll see you for your prenatal appointments. We ask that you see each obstetrician at least once during your prenatal course. We want to get to know you, and we want you to get to know each of us. We take responsibility for labor and delivery on a rotating basis. When you go into labor, one of the 6 of the obstetricians at Carter at Ob-Gyn will be the physician caring for you while you stay on labor and delivery at Carter General Hospital. At the office, you may see a nurse practitioner for some of your prenatal visits. The nurse practitioners in our office do not deliver babies. Nutrition. While you're pregnant and feeding your growing fetus, we want you to maintain a healthy diet. A diet heavy in fresh vegetables and fruits, along with lean meats, nuts, and whole grains is recommended. Do include dairy products to get in the calcium your body needs to grow your baby's bones. Try to limit fast foods, fried foods, and unnecessary sugar. In general, a pregnant woman needs to consume about 300 extra calories a day. Please feel free to discuss your nutrition, food and drink intake, and other dietary issues with your providers throughout your pregnancy. There are some food limitations in pregnancy. It's recommended that you not eat any raw or uncooked meat or fish. If you eat fish or seafood, please remember to check the fish handout in your OB packet today. We ask that you limit eating some specific types of fish due to the mercury content in those fish. It is recommended that you avoid deli meat, lunch meat, and hot dogs in pregnancy. There's a bacteria called listeria which can contaminate some of these foods. A listeria infection can be very dangerous to both you and your unborn baby in pregnancy. If you must eat these foods, please heat hot dogs, lunch meats, or deli meats until steaming hot, and do not eat raw or unpasteurized milk or foods with unpasteurized milk in them. Do not eat soft cheeses unless the label says they were made with pasteurized milk. Please review the USDA handout in your OB packet for more details on what foods to eat and how they should be prepared. Regarding weight gain, we want you to gain no more than 25 to 35 pounds for the entire pregnancy. For people who are starting out overweight or underweight, this range may be a little bit different. We know that women who gain outside of the recommended weight gain have a much higher risk for cesarean delivery. Exercise is strongly encouraged. We ask that you try to exercise at least 30 minutes a day on most, if not all, days. There are many health benefits to exercise in pregnancy. Regular exercise can help reduce backaches, constipation, and swelling. It can help reduce the risks of developing diabetes in pregnancy. It can increase your energy and improve your mood and posture. Exercise promotes muscle tone, strength, and endurance, and helps you sleep better. Get active. There's a handout in the OB packet regarding exercise. Regarding activities and other exposures, during pregnancy, sexual intercourse is okay, unless you've been told otherwise by a provider. Your provider will let you know if intercourse is not recommended. If you work outside of the home and you have concerns about environmental work hazards, please talk to your nurse today. We also want you to wear your seatbelt in the car throughout the pregnancy. If you have a cat at home, we ask that you not empty your litter box. We ask that you find someone else to do this task for you while you're pregnant. There's a bacteria that's sometimes found in cat feces that can be dangerous to your unborn child. Talk to the nurse today if you can't abide by that. If there are activities or exposures that you have questions about, please ask us now or at any point during your prenatal care. Regarding travel, we recommend that you not travel far in the car after about 30 weeks in pregnancy. We also recommend that you stay in town after 36 weeks of pregnancy. If you have a trip to plan, please discuss this with your provider or with the nurse before you finalize your plans. Smoking. If you are a current smoker, we ask that you try to stop smoking. Smoking is dangerous in pregnancy. It increases the risk for low birth rate in your baby. Try to avoid secondhand smoke as well. Please speak to your nurse today or your provider about ways to stop smoking. Do not drink alcohol in pregnancy. There are proven dangers to the unborn baby. Do not use any illicit, recreational, or street drugs like marijuana, cocaine, or methamphetamines. There are proven dangers to both you and the fetus. Flu vaccine. It's recommended by the Center for Disease Control and the American Congress of Obstetrics and Gynecology that all pregnant women get the flu vaccine. All of the providers at Carteret OB-GYN recommend the flu vaccine in pregnancy. The vaccine is safe and effective for pregnant women. The risks of getting sick with the flu are far greater for a pregnant woman and her baby than the possibility of having a complication from the vaccine. Please ask the nurse to give you literature on the flu vaccine or ask questions if you have any. If you think you may have the flu, please contact us immediately so that you can be evaluated and treated as soon as possible. Regarding medications and supplements, there's a list of over-the-counter medications that are thought to be relatively safe to take in your OB packet. Keep this sheet handy throughout the pregnancy. You'll likely need to refer to it several times before your due date. Keep in mind that very few medications are thoroughly tested in pregnancy. Therefore, limit medication exposure unless it's absolutely necessary. If you have any questions about medications, please be sure to ask the nurse or physician at your prenatal visit. We ask that you not take any herbal supplements during pregnancy. If you're taking supplements or drinking herbal teas, please discuss this with your provider or the nurse at the visit or any of your subsequent visits. We recommend birthing classes later in the pregnancy. You'll be given information about the classes at a later visit. We do recommend breastfeeding. There have been lots of studies done which show that there are benefits for both mother and infant when breastfeeding. There are breastfeeding classes available in the community if you're interested. We at Carteret OB-GYN will support all moms, regardless of how they choose to feed their infant. If you have questions about breastfeeding or formula feeding, please don't hesitate to ask us. In your OB packet, there are all sorts of information about issues which may crop up during pregnancy. For instance, there are handouts about preterm labor, constipation, nausea, and head cold symptoms. Please be sure to review the handouts in your packet and keep them handy throughout the pregnancy. We will be drawing blood work today. Your results will likely be available at your OB physical. If your OB physical is very soon after your interview, your results may not be ready yet. Your provider will discuss with you how you'll be reviewing your results. One of the tests that will be drawn today is the HIV test. This is a state-mandated test for all pregnant women. If you have any questions or concerns regarding the blood work, please ask. There are screening tests available that can tell you if you have an increased risk of having a baby with a chromosomal abnormality, for example, Down syndrome or trisomy 21. In the last few years, these screening tests have become less invasive and more accurate. There are several tests available. We will help you choose what's right for you based on your preferences, your age, your gestational age, and your risk factors for chromosomal anomalies. Most of these tests involve blood work from you. Some of them also involve an early ultrasound called a nuchal translucency. For some people, we'll combine an additional visit with a maternal fetal medicine specialist. These tests can tell us if you're at high risk or low risk for having a baby with a chromosomal anomaly. Once we know your exact due date, based on both your last menstrual period and your first ultrasound, we will know if you're eligible for any of these tests. You have a handout on this in your packet today. Please read through this carefully and be ready to let us know at your OB physical if you desire testing. If you have any questions, please do not hesitate to ask your nurse today. Again, we're so pleased you've chosen Carteret OB-GYN Associates to provide your care in this important part of your life. Thank you.